Stop for a second. What if the number you trust the most is actually making you weaker every day? Every morning, millions of seniors take their blood pressure pills and feel proud. The numbers look perfect, 120/80. But then something strange happens. They stand up and the room spins. They walk and feel unsteady. They wake up tired, even after a full night of sleep. And slowly, they start believing this is just aging. But what if it's not? What if the perfect number was never meant for a body your age? Let me ask you something. When you hear 120/80, where do you think that number came from? Most people believe it's the gold standard, carefully tested, proven for everyone. But that's not the full story. That number was never designed for people in their 70s or 80s. It came from studies on middle-aged adults, people in their 40s, their 50s, healthier arteries, faster reflexes, stronger circulation. And in that group, yes, lower was better. But then medicine did something dangerous. It took that number and applied it to everyone. Same target, different bodies, different biology, no adjustment. So now, an 80-year-old is chasing a number built for someone 30 years younger, and no one stopped to ask, should they? Here's what most people don't realize. After the age of 65, your body is not the same system anymore. It may look the same on the outside, but inside, everything has shifted. There are 3 major changes that completely alter how blood pressure works. First, your arteries stiffen. When you were younger, your blood vessels were flexible. They could expand, absorb pressure, protect your organs. But over time, they become rigid, like an old rubber band. That doesn't stretch anymore, so your heart has to push harder just to move blood forward. Second, your pressure sensors slow down. Your body has built-in detectors that adjust blood pressure instantly, but after 70, they react slower. Not broken, just delayed. And third, your brain needs a higher minimum pressure. Your brain depends on constant blood flow. And with age, it loses flexibility. If pressure drops too low, even briefly, the brain feels it immediately. This is why lower is not always better anymore. Sometimes, that slightly higher number is your body trying to protect you. If this is the first time you're hearing this, comment 1 below. I want to know how many people were never told this. Now here's where things get even more interesting. A major study published in JAMA looks specifically at adults over 75. Not theory, not assumptions, real people, real outcomes. And what they found surprised a lot of doctors. The best results did not happen at 120, not even close. The lowest rates of hospitalization, better cognitive function, and lower overall mortality were seen in a range between 130 and 145. Let that sink in. The range where seniors performed best was higher than the standard target they are told to reach. This doesn't mean high blood pressure is safe. Numbers above 160 are still dangerous, but it does mean something critical. There's a lower limit, a point where going lower stops helping and starts harming. And for older adults, that limit sits higher than most people think. Now, let's talk about the real danger. When blood pressure is pushed too low, in older adults, the risk doesn't disappear. It changes form. Studies show a 28% higher risk of serious falls and fractures. And this is not a small issue. A fall at 78 is not just a fall. It can mean a broken hip, emergency surgery, months of recovery, or worse, never fully recovering again. And here's the part most people miss. The fall doesn't happen in the clinic. It happens at home, standing up from bed, getting up from a chair, walking to the kitchen. In those small moments, blood pressure drops briefly. And if it's already low, that drop can be enough. Enough to lose balance. Enough to fall. Think of your brain like an engine. It needs constant fuel to run properly. And that fuel is blood flow. Your brain uses about 20% of your body's blood, even though it's only 2% of your weight, and it has almost no reserve. So when you stand up, blood shifts downward. Pressure drops briefly. In a younger body, this is corrected instantly. But in an older body, especially with low baseline pressure, that correction takes longer. A few seconds can become 5, 6, even 7. And during that time, your brain is underfueled. That's when you feel it. The dizziness, the darkening vision, the need to grab something. It may feel small, but repeated every day, it adds up. Now here's where it becomes personal. Because these symptoms, you've probably felt them before. Not once, but many times. Standing up and feeling slightly dizzy. Pausing for a second before you start walking. Forgetting a word that used to come easily. Feeling more tired than you think you should be. And each time, you tell yourself the same thing. This is just aging. But what if it's not? What if these are not signs of getting older, but signals that your blood pressure has been pushed too low? There's even a medical term for it. Treatment-induced hypotension. The medication is working exactly as designed, but your body no longer needs that same target. If this sounds familiar, comment 1 below, because too many people are living with symptoms they were told to ignore. Here's something simple you can do at home today. It's called the sit-to-stand test. All you need is a blood pressure monitor and a chair. Sit quietly for 5 minutes. No phone, no talking. Then measure your blood pressure. Write the numbers down. Now stand up the way you normally would. And within 1 minute, measure again. Compare the top number. If it drops by more than 20 points, that's a warning sign. It means your body is struggling to maintain flow. When you stand, and that moment is when falls happen. This is real data, and it's something you should bring to your doctor. So what should your target be? Here's a simple guide based on current evidence. If you are between 65 and 74, your ideal range is around 130 to 140. If you are 75 to 84, the range shifts higher, about 135 to 145. And if you are over 85 or more physically fragile, your target may be closer to 140 to 150. Not because higher is better, but because going too low can be more dangerous. These numbers are not rules. They are starting points. Your body is unique, but now you have something powerful, a reference, a reason to ask better questions. Now let's talk about what actually changes everything. Not more medication, not more tests, but better conversations. Because the way you ask determines the care you receive. Walking into an appointment and saying, I feel a bit off lately, won't change much. But walking in with clarity, with data, with the right questions, that changes everything. Ask this instead. What is the ideal blood pressure range? For my age specifically, could my symptoms be related to my pressure being too low? Can we test how my blood pressure changes when I stand? These are not confrontational questions. They are precise. And in medicine, precision leads to better decisions. After 25 years in cardiology, there's one thing that still bothers me. It's not patients with dangerously high pressure. It's the ones with perfect numbers who feel worse every day. Because this kind of harm is almost invisible. You're doing everything right, taking your medication, following instructions, and yet your body is telling a different story. The dizziness, the the fatigue, the quiet decline. These are not things you should accept, and they are not just part of aging. So here's what I want you to do. Test your blood pressure at home. Write it down. Have the conversation you've never had before. And if this video opened your eyes, share it with someone you care about, because this information can prevent something irreversible.